Welcome to All Things Cardio-Oncology. This is the podcast of the International Cardio-Oncology Society. My name is Steve Caselli, and I'm the Executive Director for ICOS. It's my pleasure to introduce my co-host today, Dr. Arjun Ghosh. Arjun is consultant cardiologist at Bart's Heart Center and at University College London Hospital. He's the clinical lead of the cardio-oncology service there as well. Welcome, Dr. Ghosh.
Thanks very much for having me, Steve. Really looking forward to this podcast.
And today we're going to have a conversation with two experts in electrophysiology. So I want to welcome first Dr. Michael Fradley. Dr. Fradley is Medical Director at the Penn Cardio-Oncology Program. He's also Associate Professor of Clinical Medicine at the University of Pennsylvania in Philadelphia. And Mike serves on the board of ICOS as well. So Mike, thank you for your service there and welcome to the program.
Thank you so much. Thanks for the invitation to participate. Looking forward to it.
We also have with us today Kaveh Karimzad. Kaveh Karimzad. Dr. Karimzad is Associate Professor in the Department of Cardiology at MD Anderson Cancer Center in Houston, Texas. He is the Director of Electrophysiology there, as well as the Director of Cardiac Device Clinic. So welcome, Dr. Karimzad.
Oh, thank you. Thank you for the invitation.
Well, as we begin, we're always interested on this program to learn a little bit about kind of the path that each of you have traveled in order to develop an interest in cardio-oncology. So I wonder if you could just briefly tell us how your interest in the field developed, and maybe Dr. Fradley, you could begin.
Sure. So I became interested in cardio-oncology during my electrophysiology fellowship for several reasons. When I was doing my clinical inpatient rotations, I was getting a lot of consults for patients who had cancer and were developing rhythm disturbances. And I began wondering why there was such a large proportion of cancer patients who were experiencing arrhythmias. So from an academic standpoint, that was something that was really intriguing to me. Additionally, and this is something that I think we in medicine don't always talk very much about, but during my EP fellowship, I wasn't 100% certain that I wanted to do classic electrophysiology insofar as, ablating arrhythmias and doing the very procedural aspects of electrophysiology. A lot of times in medicine, we enter down one path and then we just keep going down that path no matter what. And I think this was really an opportunity for me to think outside the box a little bit and figure out a way that I could bring together components of electrophysiology that I really loved, as well as now this newfound interest and passion in the field of cardio-oncology. And then I think the third component of it for me, which was a very personal aspect of my interest in cardio-oncology, was that during my electrophysiology fellowship, I was diagnosed with melanoma and went through certain treatments associated with that. And so it kind of opened my eyes to the area of cancer from a clinical standpoint and from a personal standpoint. And so it was an opportunity to bring everything together.
Thanks, Mike. And Dr. Karimzad, could you tell us a little bit about your journey to cardio-oncology?
Yes, sure. So during my cardiology fellowship training about 10, 12 years ago, I had the opportunity to do several cardiology consult and echo rotations at MD Anderson. In fact, out of 3 years of cardiology fellowship training, we spent 6 months at MD Anderson. And at that time, cardio-oncology was relatively a new and emerging field. And I was really impressed by the amazing group of cardiologists at MD Anderson with the main focus on cardio-oncology. At that time, about 10, 11 cardiologists working there. And I was also amazed by the volume and the variety of cardiac pathology, both in the consult service, in inpatient, outpatient, and also in the echo lab that these cardiologists were seeing on a daily basis. I became interested in cardio-oncology during my cardiology fellowship, and I also had a special interest in oncology, which I developed during my internal medicine residency. When I started looking for a job toward the end of my electrophysiology fellowship training, I was ideally looking for an academic position where, in addition to practicing electrophysiology, I would be able to practice other aspects of cardiology, general cardiology, heart failure, and also continue to use the extensive training that we received in ECHO during cardiology training. So for all these reasons, I thought that MD Anderson would be a perfect fit for me. And at that time, MD Anderson Cardiology Department had an opening for EP-trained cardiologists. My colleague, Dr. Iliescu, who is an interventional cardiologist and established MD Anderson Cath Lab in 2008, also encouraged me to join the group. And that was how I joined MD Anderson as an electrophysiologist with main focus on cardio-oncology.
Excellent. Thank you both for sharing that. It's always fascinating to hear kind of people's development in the field. And so today we want to talk a little bit more about the EP field in particular. And Dr. Ghosh has some questions for the two of you about that.
Thanks, Steve. So what we want to really explore in this episode of the podcast is the EP issues in cardio-oncology and how we can attract more EP trainees into cardio-oncology and why they should consider it as a career path, just exactly as Mike and Kaveh have done. So if I could start by just asking an introduction to both of you, what do you think the main EP issues are in oncology? Maybe Kaveh, if you could start us off.
Yeah, sure. I think this is a question that I probably need to spend a little bit more time. The unique EP issues in cardio-oncology, and not in the order of importance, but I will go over four kind of issues that I think it's important to mention. Number one, I think, is the management of cardiac implantable electronic devices during radiation treatment. At MD Anderson, we have a cardiac device clinic, and we manage on average 15 patients with pacemaker and defibrillators during radiation on a monthly basis. We've been following institutional algorithm in coordination with radiation oncology to safely perform radiation treatment in these patients. And obviously, in certain situations, device relocation is necessary, which needs to be performed after detailed discussion with radiation oncologists and considering risk versus benefits of different approaches, either lead extraction, device implantation of a new device on the contralateral side, opposite side, or using lead extenders and different options. The second item I think is worth mentioning is management of cardiac devices during MRI. Obviously, working in a cancer hospital, we are seeing more and more patients with CIEDs requiring MRI for their cancer treatment. And to safely perform MRI for these patients, we have developed, again, an institutional algorithm protocol and a team of consisting of myself, the radiologist, and device specialist. On a weekly basis, we manage about 8 to 10 patients with cardiac devices undergoing MRI. We manage all sorts of devices, dependent patient, non-dependent, conditional, non-conditional, and we only have a limited number of exclusion criteria like abandoned leads or epicardial leads or devices at ERI. The third item is obviously implantation of pacemaker and defibrillators in cancer patients. I think indications for device implant in cancer patients are more or less the same as general population with some unique features. Thrombocytopenia, neutropenia are major issues in cancer patients requiring device implants. And procedure should be coordinated with a primary oncology team to make sure that procedure performed in the most appropriate time with the least risk for complications, and obviously, especially infection. And also least interruption of the cancer treatment. And obviously, any discussion or any decision about ICD implant should be discussed with oncologists to make sure patient has reasonable prognosis. The other important options, I think CRT has a unique role in chemotherapy-induced cardiomyopathy with left bundle branch block. This has been well demonstrated in MADID-CHIC trial, which was published last year. I have had, in fact, in the last 8 years, I've been in MD Anderson. I had several super responders to CRT in patients with chemo-induced cardiomyopathy with normalization of the EF with CRT. And the last item is the medical and procedural managements of different type of arrhythmias, most commonly atrial fibrillation during chemo or stem cell transplant, surgery, and etc. And really understanding when is the appropriate time to consider ablation in these patients and when is appropriate to continue with medical managements. And always being aware of different drug-drug interactions when we are treating cancer patients with antiarrhythmics. And finally, I think very important issue is managing anticoagulation in cancer patients with atrial fibrillation and high CHA2DS2-VASc score, and the risk of bleeding due to different issues, cancer, thrombocytopenia, or patients who've been treated with ibrutinib. We know that it can cause AFib, and also it has antiplatelet properties, so simultaneous use with anticoagulation would increase risk of bleeding. What is the role of, for example, left atrial appendage closure with Watchman in this patient as a long-term kind of a strategy for prevention of thromboembolic event? So I think, sorry, it took a little bit of time, but I think these are the main issues in regard to EP practice in cardio-oncology.
No, thanks, Kaveh. I think that's a very comprehensive list of many of the different problems that EP doctors may face or their EP issues. Mike, did you have anything to add?
No, I think that really, covers all of the key components. I think that as Kaveh had pointed out, you can see that it really encompasses the entire spectrum of electrophysiology. And I think that it really underscores the fact that there's opportunities from a clinical standpoint, there's opportunities from a procedural standpoint, and then there's even opportunities from a research standpoint, both clinically and at the more basic and translational science level. So, I think that there's opportunities for electrophysiologists who are, who run the gamut of interests.
Great, thanks, Mike. And I think one of the issues that we see in the field of cardio-oncology is that it probably attracts a lot of people from a background of heart failure and imaging. And this is both as consultants and as trainees. So just that there are that many doctors like yourselves, EP specialists who are involved in cardiology. Maybe Mike, if you could start us off.
Sure. I think that you're definitely correct that many people have approached cardio-oncology either from the heart failure or the imaging standpoint, and I think that is because many of the problems that we originally identified in cancer patients were primarily myopathic. But as the field has grown and as the treatments have evolved, we're recognizing that there are a variety of additional cardiovascular effects that these cancer therapies can have, arrhythmic, vascular, etc. And because of that, it's really important to have experts who understand arrhythmias managing these cancer patients. It's important to have experts who understand coronary and vascular disease managing these patients. So it's really not just a heart failure or an imaging specialty any longer. And we really need this complete multidisciplinary approach to cardio-oncology in order to provide the most optimal care to our patients. We need the heart failure experts, we need the arrhythmia experts, we need the vascular experts.
Great, thanks, Mike. And Kaveh, what do you think?
Yeah, I think as Mike mentions, I think it's completely natural that cardio-oncology attracts more cardiologists with heart failure and imaging background. I mean, historically, cardio-oncology started with doxorubicin-induced cardiomyopathy, and bulk of cardio-oncology practice is really management of heart failure, chemo-induced, stress-induced cardiomyopathy, immunotherapy-mediated myocarditis, and etc. And also the role of echo and MRI in cardio-oncology is completely clear to everybody. And there are multiple challenges in regard to performing for EP trained or interventional trained cardiologists. There are multiple challenges in regard to performing procedures, especially EP procedures in cancer patients. But I think as the field is growing, we are learning more and we are becoming more comfortable doing these procedures and especially performing them at the appropriate time to minimize the risk and coordinating also very closely with the oncology team.
Thanks, Kaveh. And I think what we'll do now is maybe try and focus on two areas. One is how we can bring more EP trainees into cardio-oncology. And then also maybe after that, just try and understand how established EP doctors may join the local cardio-oncology or may study cardio-oncology service from the EP point of view. So if we start with the trainees first, if I could ask both of you, what should you as EP leaders in cardio-oncology be telling your EP trainees that, come and join me in cardio-oncology? Why should they do it? If I could start with you, Mike.
Well, I think that there's a lot of opportunity for growth and a lot of opportunity to really define your career and your career path in this area, because there aren't a lot of individuals who have this interest in both cardio-oncology and electrophysiology. So, you can really kind of forge your own path. And I think that there's something exciting to be said about that. But I also think that, as we all know, representation matters. And if fellows don't see individuals doing this, it's hard for them to recognize that this is a viable career path. So ensuring that those of us that are both electrophysiologists and cardio-oncologists are visible, are being a part of the different electrophysiology meetings, the different electrophysiology societies, that the journals are publishing papers about cardio-oncology, and that those editorial boards recognize that there's importance in these topics. All of that is going to really help to encourage the fellows and the trainees to become more involved and get excited and recognize that there are these opportunities that exist.
Thanks, Mike. And Kaveh, what do you think the best way is to get your EP fellows involved?
Oh, yeah. Mike touched upon very important issues, but I will basically tell to EP trainees to entice them to get into cardio-oncology that this is a really growing and evolving field with really unbelievable growth over the last 10 years, and it will continue to grow in the near future. And I think as more and more cardiologists get involved in cardio-oncology, there would be a need for expert opinion of electrophysiologists in regard to medical or procedural management of cancer patients with different cardiac rhythm issues. And familiarity with cardio-oncology is absolutely necessary for EP-trained physicians to be able to really appropriately manage these patients and also effectively communicate with the referring physician. So I think that's important for EP-trained doctors to consider involvement in cardio-oncology in the future.
Sure. And given the increasing awareness about cardio-oncology and the increasing awareness of how cardio-oncology treatments affect heart from the rhythm side and the EP side, do you think that the general cardiology training program should have more formal cardio-oncology to it? And also, how can the advanced EP training program get cardio-oncology as part of the curriculum? I mean, should that happen, or should it only be for selected people who are interested in cardio-oncology? Maybe, Mike, if I could start with you.
I agree. I think that we do need to think about ways to more formally incorporate cardio-oncology into the training curriculum, both for general cardiology fellows, but then also the electrophysiology fellows. I think that that is really the first opportunity for many of these individuals to, to learn about and experience this patient population. And I think in the electrophysiology world, it's incredibly important because these patients are living longer. Many cases, they're surviving their disease, and they're going to be the patients that electrophysiologists are seeing and treating. And so the electrophysiologists are going to need to have some understanding about the complexities of cancer patients and cancer treatments so that they can be better equipped to appropriately manage their patients.
Great. And Kaveh, I suppose you must echo those thoughts as well.
Yes, absolutely. I think with increasing number of cancer patients who require cardiac care, it's important for all cardiologists to have some knowledge of cardio-oncology in the near future. And that's why I think including cardio-oncology in cardiology fellowship curriculum would be very beneficial. And the same thing with EP, but it probably would be a little bit more challenging for EP fellowship to be exposed to cardio-oncology. I think realistically, this is only possible in large academic institutions who have a cardio-oncology program and reasonably large number of cancer patients requiring cardiac rhythm management. And I think this potentially can be done by educational conferences, by cardio-oncology group, or earlier referral to EP for cardiac rhythm management of these patients.
So I think Kaveh and Mike, you both mentioned that during your EP training, you were exposed to a number of cancer patients, and that helped grow your interest. So if there's an EP trainee who's listening, who does have an interest in kind of getting more information about cardio-oncology or training in some of the EP aspects of cardio-oncology, what is the best option they have to try and see what's available locally or to come and do fellowships with you guys? Mike, if you could start us off.
Well, I think that the first, really the first thing that a trainee can do is probably to reach out to individuals that are involved in cardio-oncology and start learning a little bit about it from those individuals. It is challenging, I think, to find the resources for cardio-oncology and electrophysiology in the majority of settings, as Kaveh pointed out. So I think that the first step, truthfully, is that if a trainee has interest, it's sort of incumbent upon them to reach out to individuals to develop mentoring type relationships, and then they will oftentimes help to guide them and give them the right resources to, further develop and grow their career.
Great, thanks. And Kaveh, what's your opinion?
Yes, I absolutely agree with Mike. But I think also think that the best way for either an EP consultant, EP specialist, or EP fellow to get involved into cardio-oncology is to establish relationships with cardio-oncologists in the institution. And they can do this through, as I said, educational conferences, scientific sessions, getting in touch with other cardio-oncology groups, and also trying to refer patients with rhythm issues earlier to EP groups, and not just waiting until the patient only needs some kind of procedure, but also medical management of rhythm issues. As I said, it's completely feasible in academic institutions or hospitals with cardio-oncology programs, but it would be a little bit more challenging in community hospitals.
Sure. And Kaveh, if I could start the last question with you. If there's an established EP consultant who's listening to the podcast who does come across cancer patients and is maybe thinking about some form of more formal EP consult service for these cancer patients, what would be the best way to approach this? And I suppose it would depend if it's an academic center versus a community hospital. But Kaveh, what are your thoughts on this?
Well, I think more or less like the previous questions, like the main issue, I think, is establishing a relationship between a EP group or EP specialist and a cardio-oncologist in that hospital, and also improving cardio-oncology knowledge through participation in either national or international cardio-oncology conferences and scientific sessions, for example, in ACC, AHA, HRS, even HRS, I think last year and this year, they started having sessions in cardio-oncology. And also, they can certainly communicate with electrophysiologists who are practicing cardio-oncology, like me or Mike. And they can communicate with us directly, and I would be happy to discuss about any unique features of EP practice in this field.
Thanks, Kaveh. And Mike, I know you have experience of setting up cardio-oncology services, but from a specific EP point of view, what advice would you have to an established EP doctor who wants to get involved in this way?
Yeah, I agree with everything that Kaveh said, and I think that if you're an established electrophysiologist and you're developing this interest in cancer patients, it's important to develop relationships with the cardio-oncologist either at your institution or in your relative local area, or even more broadly if there isn't anyone close by, to really just sort of talk through these cases and get their opinions and their perspectives. I think that you can approach this in two ways. You can be a cardio-oncologist who does electrophysiology, and in that respect, I mean somebody whose entire focus is cardio-oncology and they see the gamut of all diseases, and then they also have this additional electrophysiology training and passion. Or you can be an electrophysiologist who does cardio-oncology, so that your primary focus is EP, but then you happen to have this sort of side interest in cancer patients and the management of cancer patients. So I think as an electrophysiologist, you don't have to devote every aspect of your life to taking care of cancer patients, but you can absolutely develop a career in which cancer patients become a significant part of your treatment population and a significant part of your academic and professional interests. And so reaching out, having conversations, meeting with people, and developing relationships is really the key, I think, to developing a successful career.
I think in summary, both of you really have explained the number of different EP issues in cancer patients, and how, as an EP trainee, there's a lot of scope to develop their own practice with a wide variety of issues to get involved with from the clinical side and the research side as well. Mike, Kaveh, could I just have your last one pitch to the EP community, why they should get involved more in cardio-oncology? If I could have your pitch, please, Mike.
I think that this is an incredibly gratifying population to take care of. It's really an incredibly, it's really, I think, an incredible opportunity to get to know these patients and to help be at least a small part of their journey to journey through cancer. So I think from that standpoint, it really is an incredibly rewarding experience. I think also it is an opportunity to really kind of define your career and your career goals. And there's a lot of potential for growth and for investigation as well for the newer, younger electrophysiologists. So there's no question that you will have an incredible experience, both clinically and academically, with cancer patients and arrhythmias.
Great. And Kaveh, your last final one-line pitch to get more EP people involved in cardio-oncology, please.
Yes, sure. I think this is a fascinating field, and there is room for EP involvement in cardio-oncology. There are many different ways that electrophysiologists can help these patients going through their cancer treatment, and I think that's ultimately the goal. To get these patients to get through them to cancer treatment, and also in survival continue to manage the different electrophysiology issues in these patients. So I think it's a very interesting field, and there potential for significant growth in the near future.
Great. Thanks so much, Kaveh. Thanks so much, Mike and Kaveh, for your thoughts on EP and how we can attract more EP docs into cardio-oncology. I'll hand over to my co-host, Steve, now.
Yeah, thank you both for this discussion, and thank you for your work, and really appreciate from both of you your emphasis on patient care. That's really the end game for us, isn't it? So thank you for the work you're doing. Thank you for being pioneers in this particular area. And we really appreciate your time today. I just want to close by reminding our listeners that if you want more information about cardio-oncology generally, you can go to our website, ic-os.org, and there's a number of activities and opportunities there. And coming up in May, on May 22nd, we will be offering our certification exam in cardio-oncology. And under the resources tab, you can find information about that exam. So thank you all for your time today. We really appreciate it, especially Kaveh and Mike. Thank you for just inspiring us in your work.